Hello, this is Dr. Lisa Broyles with Way to Health MD. I'd like to talk to you today about an important topic for your immune system and for chronic inflammation, and that's your gut health. At the heart of it, you are a coral reef, not an individual. Your gut, your skin is made up of millions of different tiny organisms that are all working together to help you thrive or to create inflammation and chronic disease. You can affect the bacteria that colonizates your gut according to what you eat, what kind of toxins and pesticides you're exposed to, whether or not you've been on antibiotics or steroids. All of these things are going to affect the type of bacteria that colonize your gut and your skin. In this video, I specifically want to talk about prebiotics and probiotics. Most people have heard of probiotics, but don't really understand what they are and why they're so important. Your intestines are the main source of production of something called serotonin. Serotonin is your happy hormone. Most people think that this is made by the brain, and there's lots of medications that doctors will put people on when you come in with anxiety or depression. They'll put you on serotonin reuptake inhibitors. These are, for example, Paxil, Prozac, Lexapro. Well, these medicines help your body to keep its serotonin around for longer. But ideally, wouldn't you like to just make more of your own serotonin, which makes you feel more happy and peaceful? And the way to do this is to have a healthy gut above all things. Your gut is responsible for at least 80% of the serotonin that your body makes. So how do we do this? We make sure you have the right flora balance in your gut. If you have ever been on antibiotics, especially recently or multiple rounds, then you can have an overgrowth of yeast in your gut. You can have an overgrowth of bad bacteria that makes you chronically inflamed or produce a lot of gas or causes irritable bowel. So you do want to eat food choices that help support healthy flora in your gut, and we'll get to that in just a minute. But ways to have good probiotics, good healthy flora in your gut that help you to make more serotonin, help you to decrease chronic inflammation, is to eat fermented foods. So you can make your own kombucha or kefir at home. I tend to make kombucha in the summer and kefir in the winter. You can make your own kraut. So all of these are very inexpensive options. You can eat pickled vegetables, pickled beets, pickled carrots, pickles, drink pickle juice. You get the idea, okay? One of my 10-year-old daughter's favorite foods is pickled everything. So we tend to do a little bit more pickling of vegetables and cabbages than we used to. So if you can't eat fermented foods for one reason or another, or just don't have the time, you can take an oral probiotic. It is important. The brand matters as well as the flora. Generally, you want it to have a 50 billion colony count or higher. Depends on the brands. My top favorite brands are Prebiotics. They have a product called BioDoff 7 that's 7 different strains specially formulated to make it through the stomach acid and be powerful and effective. You can take one daily or one with meals depending on what you need. The other company I really like is Designs for Health. They have one called Probiophage DF that is a combination of probiotics and prebiotics. That's quite nice. So if you have to take an oral probiotic, those are good blends. So prebiotics is the indigestible fiber that you get through your diet or supplements that feeds the probiotics. So the bacteria in your gut need to eat something. So bad bacteria will make you crave sugar, bread, pasta, carbohydrates, and those will further increase the numbers of the flora that you don't want, that increase weight gain, that increase inflammation. You want the flora that promotes weight loss and good serotonin levels and healthy lower levels of inflammation. So these types of bacteria prefer more of a plant-based diet. This is why it's so important to get a lot of fiber and a lot of vegetables in your diet, amongst other reasons such as decreasing your risk of colon cancer. But prebiotic examples are raw beets, raw garlic, raw asparagus, raw onions. You're getting the picture. Some people with a problem called SIBO, or small intestine bacterial overgrowth, are usually unable to tolerate these prebiotic food sources and may have to take prebiotics as a supplement after their SIBO is treated. However, the majority of people can tolerate prebiotics in moderation. One of my favorite things to do is to take green bananas or green plantains, chop off the skin, blend them up and make mashed potatoes or pancakes. I love paleo pancakes with plantains, some of my kids' favorites. So you can use the green bananas as mashed potatoes instead of mashed potatoes, which is much better for you than a white potato. If you prefer a dietary supplement for your prebiotics, you can buy inulin chews, you can buy beta-glucan, you can also take apple cider vinegar. So this is just a short summary of some good sources of prebiotics and probiotics and why they're important. I'd love to talk to you more in detail. If you would like a personal consult, please reach out to me at lbroyles@waytohealthmd.com. Thank you and have a good day.